Dr. Susie, how are you?
Hello, good. How are you?
Good. It's so good to see you again. Let's just jump right into it. I know you're short on time. As an emergency room doctor, I see you got on your white coat. You're in your office. You have a shift today?
No shift, just administrative.
Ah, so doctors doing busy work.
Yes.
Yeah, so it's Health Literacy Month, and you're part of our Health Literacy Tribe. So I always like to talk to you just to get some questions answered from the public. So we only have a few today. And then we'll maybe circle back later this month in case we have new questions.
Sounds great.
So the first one today is really kind of a fun question. Someone was asking about how similar is an emergency room in real life to the ERs they see on TV, like in Grey's Anatomy, or remember that show ER?
Yeah.
Is it similar? Is it different? If so, how?
That's a great question. I would say there's a lot less romance, a lot fewer spontaneous adoptions. I just remember from ER, they were sort of constantly adopting children that were not attached to anybody or whose parent had a horrible tragedy. So I would say that there are fewer of those cases like there are on TV where everyone's running around yelling stat, like that. There are just fewer of those. They happen occasionally. I always like to tell people, if your ER doctor is running around like flapping their arms and screaming and yelling, like you're probably in the wrong emergency department with the wrong ER doctor.
Why is that though?
Well, because ER doctors are trained to handle things that are happening fast and are very dangerous. So if there's a high level of sort of adrenaline going on when the doctor's faced with that situation, that really isn't fitting with their training, right? Their training should prepare them for that sort of big excitement. But I would say the chaotic feeling of those TV shows, the teams, like everybody looks like they're all on the same team, like that's really how the ER is. So those are the similarities, that team feeling and like the busyness. But the major emergencies you wouldn't be able to identify right away, because a lot of people are having major medical emergencies, but we're pretty calm taking care of them. So you can't always point out as a layperson like who's in crisis.
Now, one thing I noticed on a lot of these TV programs is they do, you're an ER doctor, but you do everything. You do brain surgery, you like cut people open with gunshot wounds, you do all it. Is that right?
So no. So we're not surgeons. Like I would never open anybody's abdomen, like their stomach. If they had appendicitis, I call a surgeon to do that, and they bring them to the appropriate operating room, etc. Now, we do have on the trauma side of emergency medicine, we do have patients who have gunshot wounds, and occasionally, if they're literally on the brink of death from that wound, they will be opened up right in the bay where we are, but it's done by a trauma surgeon.
Okay, so, not by an ER doctor.
Right. We do things like sew up cuts. You know, you can have a pretty deep cut, like you get a cut on your face and went all the way through your muscle. We could still sew that up as an emergency physician. If you had a huge boil that needed to be opened up, we can do that kind of procedure. So we do procedures, but not surgeries.
Okay.
They call them minor surgical procedures is what they call them.
Yeah, because on TV, there's a lot of surgery and like baby deliveries happening in the ER. So yeah. I wanted to get to that question because I thought it was so fun.
Yeah. I mean, we are trained to deliver babies. I've delivered one in 20 years, but that was when I worked at a hospital that didn't have OBGYN.
Oh, gotcha.
Yeah.
So
we're allowed.
You have a choice.
Yeah.
Yeah. So there's a lot of talk nowadays about people using the emergency department like it's their primary care doctor, or going to the emergency department when they should either go to their doctor or do something else. So can you help people understand, when should you go to the emergency room?
Yeah. I mean, it's a complicated question nowadays because I feel like the medical establishment is really hard to navigate. And for people who are working all day and can only have evenings to take care of themselves, or weekends, it's really hard to get to the right place, precisely the right level of care for your particular problem. I do think that here's how I would differentiate it. Like if you have something and you're worried, number one, that you could die from it momentarily, or, you know, die from it, or you could lose a limb from it, of course you come to the emergency department. I think where it gets trickier is like, oh, something's been bothering me for a while, and now I really need an answer. Or my family member tells me, you got to go get that checked out right now. Like we've had enough of this being a problem for you. So I do think if something's been bothering you for a while and you're curious what the problem is, that's not a reason to go to the emergency department. But if something's happening to you and it's getting worse kind of rapidly, or you're literally afraid that in short order it's going to really hurt you, those are times to go to the emergency department.
Now, what about calling 911? A lot of people aren't sure when to call 911 or if it's okay to call 911.
Yeah, another tough one. I think it's the time to call 911 technically is when you think that your life is in danger from the process that's happening to your body. That's technically when
I love that. Say that again.
When you think that your life is in danger, there's a danger of losing your life from a process that's happening in your body at that moment, life or limb, let's say, life, arm, leg, though that's the time technically when you call 911.
Yeah. Okay.
You know,
and from your experience, how long have you been an ER doctor?
20 years this year.
Yeah. So what are some of the most common questions you get from people about the emergency department? Things people often want to know, but don't feel like they should ask.
One is, for example, like, why doesn't the ER do XYZ? So my knee's been killing me. Why does the ER just do an X-ray and not do an MRI? That's a really common one that people come for. They've had it with whatever's happening and they just want the answers. So in other words, like, why doesn't the ER get to the bottom root of every problem? And that's because really the function of the emergency department is to make sure that the patient is okay. That's really what our job is. So for example, if your knee is really hurting you, and we can tell by x-raying it and looking at it that it's really hurting you, but there's nothing life or limb threatening about it. It's not going to fall off. You don't need to have surgery on it today. Then we've done our part. And to get an MRI would take another 6 hours of ER time. An MRI takes about 45 minutes, but to get in the line and get you on the MRI table will take another 6 hours of having you there and taking care of you. So we just can't operate that way. We can't get to the bottom root of everything. Our job is to make sure people are okay and safe. And if they need admission to the hospital to be okay and safe, that's our job too. If they need IV antibiotics to be okay and safe, that's our job too. But it's not our job to find the ultimate answer to every problem.
Yeah.
That confuses people because we have the capacity, we have all the tests available, but we can't use all of them for everybody. Yeah.
Well, I'm glad you brought that up. And you also mentioned things taking multiple hours. Why does it take so long to be seen from start to finish in the emergency department?
Because how do I describe this? Like, because we have all the tests available, but so say CAT scans, for example. CAT scans are it's a really advanced kind of X-ray to check someone's abdomen. So you come in and you have an abdominal pain and you need a CAT scan to find out what's wrong with you. Well, yes, we agree. Maybe there's appendicitis going on. We agree. We think you need a CAT scan too. So we sign you up for a CAT scan. Well, we have 120 patients and say 10 of them need CAT scans right now. Each CAT scan takes 20 minutes. That's 200 minutes. So it's going to take 200 minutes is like an hour, 3 hours, right? So it's going to take 2.5 hours to get you there because you're the 10th person in line. Now, so that's really aggravating. But on the other hand, we can't have 10 CAT scanners so every single person can go right now. We can't have 100 doctors to take care of 100 patients. So we're just trying to dole out all the things we have to a lot of people in the right order. Who's the sickest? Who's in the most danger? That's who we have to find and quickly. Like if we think you're having a heart attack right now, well, yeah, we focus all our attention and you go first. But another person might say, well, I have some pain in my chest, or I have a little shortness of breath too. Like, why don't I go first? Well, because by our judgment, we think, well, you have it, but we kind of look at it, but this other person could die soon.
Mm-hmm.
So it's rough to wait, but you got to wait behind the person who might die sooner. And like I
Yeah.
said, it's not always something you can tell by looking. So that's really aggravating for people who come to the emergency room.
Yeah, because they think they can look and tell how sick someone is. Yeah.
Yeah. And I
Yeah.
don't blame them. I mean, it would seem, you'd think so, but there's a reason why we're doing all the blood tests and the EKGs and things like that. And because they tell us how fast we have to take care of people.
Mm-hmm. Now, some people have access to urgent care versus emergency.
Mm-hmm.
So how can people tell the difference? How do they know if they should just go to urgent care or if they really need to go to the emergency room?
Well, that's a tricky question. Urgent care has people to help you decide if you're having a serious emergency. If if you think like, well, I don't think this is too bad, but I'm not really sure. But you don't think you're dying at that moment, that's a good reason to go to urgent care. They can help you figure out how urgent it is and what might your next step be. Like, what other doctor do you need to see in this coming week to figure it out? Urgent cares have, at least the ones that are affiliated with my place, which is MedStar, they have x-ray, they have EKGs, they have COVID tests, they have strep swabs, they have urine tests, they don't have blood work, and they don't have CAT scans. So that's sort of the difference that I think if you're thinking, oh, if my doctor was available, I'd go to my doctor, that's a good time to go to urgent care.
I love that. Yes. Okay. Gotcha.
I think that might be the most useful way to think of it.
All right. Well, I want to give you the last word. Do you want to tell us something fun or really interesting that you saw or learned in the emergency department before we go?
Well, I think I'll repeat something that I've said a few other times, and that is that something great that I see in the emergency department is, we've been on a real roller coaster ride with COVID. We've had a ton of patients where almost all of our patients had COVID and people were so sick right and left. And then we've had times like now where it seems to be calming down a bit and we have to pick the needle out of the haystack and find the COVID patient. But through the whole COVID crisis, people in Washington, D.C. have been wearing their masks and doing the right thing to take care of take care of the people around them, other people who live here. And I don't know, I just always like to say, when I think anybody from DC will be listening, that I'm really proud to be from DC, and I'm really happy that people in this town have really taken COVID seriously and done the right thing by the people around them.
Yeah.
So thank you to everybody it helps us out a lot.
Yeah, that's nice. And thank you, Dr. Susie, for being on the front lines for over a year and a half and just sticking in there, hanging with us. So I really appreciate your effort, and thanks for being here with us and for being part of the Grapevine team.
Absolutely. You're welcome. Thank you so much, Lisa.
All right. Take care.
See you.
Bye.
Bye.